Mr. President, I rise today to speak about an issue that, candidly, we don't talk enough about around here, and that's the threat to the Affordable Care Act in the lawsuit that was filed and is now in a federal court, this time in the Circuit Court of Appeals for the Fifth Circuit. Earlier this month, there were oral arguments. That case could be decided in a matter of, or a short time frame, maybe even this fall. And because it doesn't, I guess because it's not an issue that's being debated in the halls of Congress by way of hearings or votes or otherwise, it doesn't get the attention that it warrants. This lawsuit, which is now a direct challenge to the constitutionality of the Patient Protection and Affordable Care Act, would be every bit as devastating and harmful as the repeal efforts that were undertaken 2 summers ago, 2017. And though the consequences of success in that lawsuit would put us in the same place we would be if, put the country in the same place it would be if the repeal effort were successful. We know, for example, that the protections that were put into place in the Affordable Care Act, basically the Affordable Care Act had 2 parts to it if you wanted to simplify it. One was new protections and the other was new coverage. So 20 million people got covered, roughly 20 million that didn't have coverage before. Most of those 20 million, or the higher number at least at the time, were folks who gained their health coverage through Medicaid expansion. And as we now know, Medicaid expansion has had a number of positive impacts on the American people. It came into force, really came into effect right in the middle of, or in one of the early stages of our broader awareness of the opioid crisis, the addiction crisis. Were it not for the expansion of Medicaid, a lot of people in my home state of Pennsylvania and around the country would not have treatment for opioid misuse, or the broader category of substance use disorder conditions. So Medicaid expansion helped a lot of people with treatment, which is essential to free yourself from the grip of an addiction that we've seen so often. So if this lawsuit, for example, were affirmed in the circuit court, it was successful in the district court. If it were affirmed in the Fifth Circuit, that would mean that that court would have declared the Affordable Care Act unconstitutional. The effect of that is Medicaid expansion goes away. Protections for a much larger number of Americans, not simply those who needed opioid treatment or treatment for an opioid addiction or substance use disorder condition, not just those who were newly enrolled, the roughly 20 million who got coverage. When you're talking about the protections, you're talking about a much larger number of Americans, maybe as high as 150 million Americans or more, who had protections not only in the circumstance where they had a pre-existing condition, but also protections against capping the coverage someone would get or the treatment they would get over a year or over a lifetime. Just to mention 2 or 3 new protections. For example, all those young people who were able to stay on their parents' health insurance plan until the age of 26, that would go away too. So you're talking about a tremendous coverage loss of at least millions of people, potentially as high as 20+ million people, and the wiping out of the elimination of protections for tens and tens and tens of millions of Americans. Now, you would think in that circumstance, those who have been most determined to have the Affordable Care Act struck down, you would think, because they've had about 8 years now, give or take, to prepare something to replace, You would think they would have a replacement ready to go. Maybe a replacement enacted into law, but at least a replacement that is ready to go on day one, has all the details worked out. And not just any replacement, not just a replacement that has words like pre-existing conditions in the title of the bill, but something real and substantial and credible on a complicated subject like health care, meaning that the replacement would cover at least 20 million people, would provide all the protections for all those Americans, whether it's on pre-existing conditions, protection against a pre-existing condition or otherwise, and would be comparable in its impact, its positive impact on Americans. You would think that bill was ready to go and ready to be enacted into law. That is not the case. And I shouldn't say I was surprised, but I was somewhat concerned when I picked up Politico, I guess it was last week, about a week ago now, and a number of Republican senators were expressing the hope that the lawsuit would be successful, the hope that the Affordable Care Act would be declared unconstitutional. But what I didn't see in that article and didn't see in a lot of other places is a replacement that will provide a comparable, if not identical, measure of protection. Because that's what they've told us, right, all along, that they have another way to do it, and the American people are all going to be better off because of it. That's the basic promise that's been made by the Republicans here in the Senate and the House over many years. So you would think that would be ready, but it apparently is not ready. So I hope that maybe in the month of August, that plan will be developed and ready to go. And not just any old plan that has a nice title on it and asserts protections that can't be brought to fruition or brought into effect, because when you provide the kind of protections that the Affordable Care Act provides, you got to make the math work. You got to make sure you can pay for it. You got to make sure that the policy will support what you promise in the details of the legislation. So we'll see what happens. But it is now, if this lawsuit were to be affirmed at the circuit court level, I'm assuming that there would be an appeal by one side or the other. But if we reach a point where a court has said that ACA is unconstitutional, I hope that there's going to be a replacement that will provide all of the protections, all of the coverage, and all of the essential elements that were in the Affordable Care Act done a better way, because that's what they've all promised on the other side. I don't think that's likely to happen. Something's going to give. Something will be cut. Something will be taken away, or a lot more than that. Just by way of one example, just one number, only one number for today, 642,000. I think it's 642,700. That's the estimate of the number of children who live in Pennsylvania who have a pre-existing condition, okay? So any change in law by way of the court, a federal court or the Supreme Court or otherwise, or change in law pursuant to congressional action, has to make sure, among many things, that every one of those 642,700 children in Pennsylvania have protections in place by law for a pre-existing condition, in addition to all the other adults across Pennsylvania. Basically, it's almost 1 out of every 2 Americans has a pre-existing condition. That's the rough estimate. That's a lot of people across the country. Some people believe, some estimates, credible, reliable estimates, have it north of 130 million Americans. So they're the only 2 numbers I'll give. So the lawsuit is problematic. Now, if that were all, that would be bad enough. But there are 2 other things that are problematic when it comes to health care. One is the proposed cuts by the administration. Now, I realize that House Republicans and Senate Republicans may not agree with the president's proposal, but he's in the same party and his budget director's in the same party, and the Congress of the United States has to react to that budget proposal. The administration proposed a 10-year Medicaid cut of $1.5 trillion, and that's with a T, trillion, not billion. $1.5 trillion cut to Medicaid. A similar cut, or I should say a comparable cut, but actually a lower number, to Medicare over 10 years, $845 billion. Well, you've got to be able to say, okay, if there is a replacement, a credible replacement that provides the identical protections and coverage that the Affordable Care Act provided, if that is the case, what would happen to health care if you cut Medicaid by $1.5 trillion and Medicare by $845 billion? Got to answer those questions if you're serious about health care. Now, if you're just kind of moving things around and having a talking point for a campaign, maybe, that's different. But if you're serious about health care, and you're serious about coverage, and you're serious about adverse impact on kids, people with disabilities, and seniors, you can't cut Medicaid by $1.5 trillion. One way to describe Medicaid is the nursing home program for the middle class in many instances, okay? So Medicaid is not a program for someone out there, someone distant who is not worthy of our support and our help. Medicaid is us. Medicaid is who we are, because we decided more than 50 years ago, we are the United States of America, and we're the strongest country in the world for lots of reasons. Thank goodness we have the strongest military. Thank goodness we have the strongest economy. But we're also the greatest country in the world because folks around the world have seen that they can follow our example once in a while. And they saw more than 50 years ago that we said, if you're a child in a low-income family, or you have a disability, or you're a senior trying to get into a nursing home, Medicaid's going to help you do that. And we also passed Medicare at the same time. So if you're serious about health care, you've got to be really concerned about these budget cut proposals by the administration. Third and last topic on this is the efforts undertaken by the administration when, in the midst of failing to repeal the Affordable Care Act and thereafter, the efforts to sabotage the Affordable Care Act, and not in any way an overstatement. When you have an advertising budget to let people know that they can go to the exchanges, not the Medicaid expansion, but the exchanges, to get health care coverage and to get a subsidy to help them purchase health care, maybe for the first time, millions of people got that opportunity, and millions still have it. In order for folks to know about that, to know about their eligibility, to know about the benefits of that, you got to advertise. We know that. The administration cut the advertising budget by only 90%. Not quite 100, but 90% cut in the advertising budget. Also, other ways where they've undermined and sabotaged the system. So, if you're concerned about health care, you got to be concerned about that sabotage. You got to be concerned about Medicaid and Medicare cuts, and you got to be concerned about this lawsuit. So we have a lot of work to do just to protect the gains, the coverage gains and the protection gains that have been hard won over many years that benefit tens and tens of millions of Americans. Not sure I can put a total number on it. So I hope that those who are rooting for this lawsuit to be successful have factored in all of that when that day comes, if it were to come, to change health care radically and dramatically for the American people. And with that, Mr. President, I will yield the floor.